Children get vaccinated for COVID-19 as early as the spring. Here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Good to see you.
Hi, Emily. Good to see you too.
So this was exciting. Dr. Anthony Fauci said today he is hopeful that a vaccine could be available for kids 12 to 17 by late spring, early summer. What do we know about the clinical trials so far on this?
Yeah, so we know that the Pfizer trial in adolescents has completed enrollment. So we might expect even in the next several weeks to start to see some data from the adolescent trial, at least in terms of the safety of that vaccine in adolescents and the immune responses that were achieved in adolescents. We know the Moderna adolescent trial is still enrolling. And we also know that, as you said, both of these trials were for children over the age of 12, and they're both testing the same vaccine doses and vaccine regimens that were tested in the phase 3 adult trials.
But the next couple weeks for results, I mean, that could be great. So you mentioned this here. Are there any trials right now on vaccines for younger children, even babies?
There aren't any that are yet enrolling that I'm aware of, but certainly if the data from the adolescent trials suggest that these vaccines are safe in adolescents and that they elicit reassuring immune responses in adolescents, we would expect to see trials in younger children, probably in 5 to 11-year-olds, very shortly thereafter. And it would likely be a stepwise approach, moving into younger and younger children in a serial type of manner.
Okay, so because we know we're doing it this way, if the state's rollout goes as planned, we really could have a situation where all of the adults are vaccinated, the kids aren't. Would we still see infection rates drop significantly?
Yeah, well, first of all, I'll just say, wouldn't it be great if we get to a point where all of the adults are vaccinated? Because the impact of that on hospitalization rates and on deaths due to COVID-19 would just be enormous. But we have to remember it's really important to get kids vaccinated for a few reasons, 3 reasons really. First of all, we need to protect kids. While we keep saying that we're grateful that kids seem to only, by and large, have mild infection, some do get very sick and require hospitalization. And we've had about 200 pediatric deaths from COVID-19. We also have seen hundreds of cases of MIS-C, a very serious inflammatory condition in children a few weeks after a COVID-19 infection. Secondly, we need to get kids vaccinated to be able to continue to keep older individuals protected. We know kids can transmit this virus to adults. And even if adults are vaccinated, the vaccines are not 100% effective at preventing serious disease. They're very good, but we need kids to reduce that reservoir of infection even more. And lastly, we need to remember that people under the age of 18 make up about a quarter of our population in the US. So it will be critically important for us to not leave a quarter of our population without immunity to this infection if we want to make steps towards the type of population level immunity that's required to really get this pandemic under control.
Yeah, all really important insights. And when that data does come out, I know we'll be checking back in with you for your insight on it as always. Thanks so much for your time, Dr. Moffitt. We appreciate it.
Thanks for having me.